My name's Mike. I am with Eardex, so I'm going to give you guys just a quick rundown of the machine and the two functions of the machine. Most of the time the doctors will say they want to do either a micropulse or a G probe. So the difference between those two is a micropulse is actually a lesser invasive glaucoma procedure. These are for patients that still have good visual potential. Maybe they're on several drops and the doctor wants to try to get them off a couple drops. It's usually less invasive, like I said. The G probe is for more advanced glaucoma, people that have maybe they have hand motion vision or count fingers, they have a painful eye, they're on several medications. This is just a procedure that's going to help alleviate some of that pain and reduce the pressure for the patient's eye. Essentially what the micropulse is doing, the less invasive, if you think about if you had a candle with the flame on it and you go really, really slow and hover over the flame, it'll burn your hand. If you go fast, you're not going to feel anything. So what the micropulse is doing is spreading that energy across the ciliary body, which is what is producing the fluid inside the eye that's making the pressure increase. What it's doing is stimulating that ciliary body to provide more flow so that the patient's eye pressure is lower. The the G probe, what it's actually doing is destroying the ciliary body. So it's a last ditch effort to lower the pressure. That being said, the two probes are different. I don't know if I want to pass these around, but one looks kind of like a rabbit, two little ears, and the other one just kind of looks like a ramp. So I don't know if you want to pass those around. We'll go this way.
Don't trip.
Here they are side by side.
Okay.
I just cut the cables off.
See, Nicole said sounds like fun. I'm sure. Take a round. Get a chance on your ankle.
So we'll get a little bit into the machine and what the probes are doing. How long do I have?
As long as you need.
Okay, I'm not going to be too long. Essentially, we're going to turn the machine on by the key. It's going to go through its little boot up cycle here. Now, each of the boxes of probes are labeled. One's G probe, one is micropulse. So in the event that the doctor wanted a micropulse and you accidentally put in the other probe, it's going to recognize that, hey, this is not the correct probe for what you set it up for. Which you'll just have to open up another probe and put the proper one in. So when it comes up to this screen, the most common thing to do, there's presets in here for what the doctors want, the most common settings. So for micropulse, do we have the probes? They still, oh, thank you.
Well, we've got the two in your hand. These are the fake.
So the micropulse, essentially what this is doing is, like I said, you're moving your hands slowly across a flame. They're doing this in quadrants. So they're, gotta be able to see it here. They're essentially going like from 12 to 3, and then from 3 to 6, from 6 to 9, from 9 to 12, but they're doing each quadrant 4 or 5 passes with this. So that it's called sweeping technology or sweeping management. So they're essentially taking 10 to 15 seconds to go from 12 to 3, and then it'll ding, and then they have to reverse. They do that 4 or 5 times. So that's the sweeping technology. So we'll hook this up in here. One other thing too, with the probes, there's a timer chip inside all these probes, so that should you set it up and walk away from the machine, maybe a case got bumped or something like that, and you come back in and you go to use this and it'll time out. It was a fail safe that they built into the system because years ago people tried to use the probes multiple times. So you know, number one, it's against the law, and number two, it's kind of gross. So now when you do set this up, there's a little yellow ring inside, and as you tighten this up, the ring will illuminate fully, like that. So I'm gonna go to settings first. Presets, sorry. Presets is up here. And it's got MP3 hemispheres or MP3 quadrants. So whatever the doctor wants to do, they can do either a whole half of the eye or they can do the 4 quadrants like I mentioned. So most are doing quadrants. So I click that and I hit select. So this system doesn't have the latest software. The latest software is set up for 5-second increments. So they could do 5 15-second sweeps per quadrant. This one, it's got 50 seconds, so that's 5 10-second sweeps. The power, not sure why it's not going up. The power should come up as 2500. So maybe because this is a demo probe, it's not giving any energy out. But that's mostly what they'll do is 2500 millijoules. This probe is not powered, so it's only got the red light. When you hit the green button to go, that's basically arming the laser. Should all have your safety glasses. Whoever's on in the room should have these on. The beam itself is only coming out maybe a millimeter or 2 out of this probe. So if you're standing on the other side of the room and you forgot to wear the glasses, chances are you're safe. So it's more of a safety precaution, but nevertheless, it's better to be safe than sorry and have the glasses there. So they're essentially going to do the foot pedal, and during this time they're essentially doing that quadrant sweep. So they're going back and forth, and the slower the better. So every 10 seconds they should be changing direction. So they should be coming back. And then back the other direction. And then once this gets to the end of the treatment, that's essentially one quadrant of the eye. Now they're going to have to do another quadrant, so you just hit this 0 and it's going to start the cycle again for the next quadrant, and so on and so forth. At the end, you'll just hit the green button to disarm the laser, and you can take the probe out. These are just normal disposables, nothing special about it. With the micropulse, from time to time, every once in a great while, we get a report that the probe started to smoke, or it started to burn the patient's conch. What happens a lot of times is, not a lot of times, from time to time, is some viscoelastic or whatever they're using to lubricate the eyes, genteel gel, sometimes xylocaine jelly to help, anesthetize the eye, gets up inside the probe. So what's actually burning is that material that kind of got clogged up in the probe. So if that would ever happen, just disconnect this probe, the probe you're using, and just open up a new one. Let me know, and I can always, comp you one for situations like that. Happens every once in a while, maybe. I can't even think of how many. Like in the last 3 months, I've heard it too. So, and that's across the country. So, not that common, but it does happen. So that's the micropulse. I'm going to go back to presets. Now for the G probe, there's two different settings here. One for a dark iris, a darker eye, brown eyes, whatnot, and there's one for lighter eyes, so somebody that has like bluish or hazel eyes. It just treats the pigment in the eye a little bit differently, a little more or less aggressive. So I'm going to go for the dark eye, because most people that are dark eyed, we're going to hit select.
Micropulse off.
So what this is doing is it's treating for 4 seconds. The difference between this one, like I said on the micropulse, it's sweeping the probe across. This is essentially just holding it in one spot. And they hit the pedal, and for 4 seconds, it's coagulating the tissue about 2 millimeters below the surface of the eye. You always want to reset this button here, because that counts how many spots. The doctor's probably going to do anywhere from 18 to 21 spots per patient, somewhere in the neighborhood of 5 per quadrant. So let's give this a shot. This one will be 4,000 milliseconds, which is essentially 4 seconds. And the power is usually at around 1450. So it's less power, but it's longer duration. So it's essentially coagulating the tissue. So we'll go green here, and this one they just hold. They hold on the eye. It'll hum. That's one spot. Then they just move it over one. Hit it again. That's 2 spots. And then they just go one right next to each other. And the total time of all these treatments is less than 5 minutes. Are there any questions so far that anybody might have, or anything they've seen with the machine in the past, or anything like that? No? That's kind of it in a nutshell with everything. These demo probes, like I said, don't have the powers dialed in when they're hooked up. Let's see if we can get it to show up though. So, preset, dark eye, I'm going to view. So here is the normal preset. So it would be 4 seconds at 12.5 or 1,250 milliwatts. That's just the power. And then let's go back. Presets, so the light eyes, we'll view that one. So this one's 3.5 seconds, but it's a little bit more power at 1,500 milliwatts. So depending on where it's focusing the energy in the pigment of the eye, that's what the G probe is doing. A couple other little tidbits of information. Like I said, you want to use like gentile gel or xylocaine jelly that helps lubricate the pathway so the probes don't tear the conj. That has happened in the past. The other thing too is because it's a clean procedure and not a sterile procedure, it's highly recommended to not use betadine solution in the eye. The laser energy is focused towards pigment in the eye. So if there's betadine and it's on the surface, the energy is going to penetrate the pigment and not necessarily the structure of the eye that it's after. So that's one thing. The other thing too is if the patient comes in and they've got a pretty red, angry eye, the laser energy is going to focus probably on the blood vessels and not necessarily the structure of the eye. So whatever the doctor has for protocol, sometimes they'll put, phenylephrine. They may call for that, put phenylephrine on there to kind of dilate the, or actually to, to reduce the blood vessels, at least where they're going to treat anyway. That helps sometimes. So that's just, a little caveat for you guys to know, if you see this red angry eye, you might be seeing that patient again because the one thing about micropulse is you can repeat it. So if the patient, let's say, has a micropulse done and 9 months later the pressure starts to rise, the doctor can always bring that patient back, do micropulse again, use the same dosage, and maybe the next time around they'll get 2 years out of it. So that's one of the nice things about micropulse, is that it is repeatable, and patients, it's kind of like a lesser known therapy for glaucoma. A lot of doctors will go right to a certain device, or they'll add a drop. We're kind of out there trying to promote micropulse because it is an option for the patient to try and weed off some drops. So that's kind of it. Any other questions? My card's on the top, so should you, actually it's not on the top, that's the other guy's. I'll put my card in here. So should there be a question while you're in the middle of the case, certainly give me a call. We could FaceTime or whatever if I can't make it. And usually it's just a quick walkthrough. I've had to do that before. That's pretty much it. So, you're welcome.
If you're in the room, don't pull the probes. The doctor will, because they're usually not sure which one they're using until the day of, and Dr. McLumpy will pull the probe, hook it up, and do her own settings the whole time. She's pretty self-sufficient, so.
Yeah, and most of them will.
Yeah.
And the probes are in, or the settings are in there with the most common. They may just alter those a little bit.
Yeah.
Yeah, that's pretty much it. Most of the doctors in the centers are adjusting their own.
Yeah.
They know what works. Now on the G probe, one thing I forgot to mention is sometimes you'll hear a pop while they're doing it, and what that is actually doing, you're hearing the laser vaporizing the tissue. Some doctors like that. They go, oh, I know it's working when I hear the pop. Sometimes it's too much, so they may turn the power down a little bit till they don't hear a pop. Doctor preference. Some like to hear it simply because they know it's doing something. So just in case you hear a pop, it's not a bad thing. It's just, it happens. So
Thank you.
you're welcome.